Now, in the last 5 years, urinary tract infections have led to more than 1.8 million hospital admissions in England alone.
But despite their prevalence, some medical experts have argued that UTIs are under-researched and can often be misdiagnosed.
Yeah, so today Dr Zoe's joining us, share her advice. Hi, Doctor.
Hi.
Good to see you, Zoe.
Thank you.
OK, so firstly, what are the symptoms of a UTI?
Right, so UTI stands for urinary tract infection, and that's when bacteria that shouldn't be in the bladder or the urethra, the tube that we'll pee out of, get into there. So the commonest symptoms are what we call dysuria, so that's discomfort or pain when passing urine, often a burning pain, sometimes right at the end, sometimes can be felt more of a pressure. Needing to go to the toilet more frequently or more urgently. You might notice a change to the urine. It might be more smelly, it might be cloudy, or the urine might just be dark, but that could also be, without any other symptoms, dehydration. Yeah. If the urine infection progresses and gets more serious, it can cause sort of lower abdominal pain just above the pubic bone or back pain. You can get fever, something called rigors, which is when you get that uncontrollable shaking. If anyone's ever had that with a fever, they'll know about it. And, of course, it can progress up from the bladder, up what the tubes called the ureters, which lead to the kidneys and cause what we call an upper urinary tract infection, which is more serious.
Oh, my word.
So that's urinary tract infection.
So it sounds really sore and painful.
Yeah, well, the commonest type of UTI, which affects the bladder, they're very, very common. In fact, 50% of women will get one at some time in their lifetime. Only about 2% of men do.
Is that because, you know, genuinely
anatomy.
Exactly.
Anatomy. So, you know, the bacteria essentially...
I don't know how I was going to get there, so yeah, thanks.
I'm happy to say the words. The bacteria essentially need to get from your anus, where they're coming out as poo, into the tube that you pee out of, the ureter. So if you think about the anatomy of a woman, those two places are quite close together. Yeah. Whereas in a man, the urethra is at the tip of the penis, so therefore it's much more common in women. And if a woman
how does that happen then? Is that someone wiping maybe from the back to the front?
That's
instead of the front to the back?
So that's why we always advise wiping from the front to the back if you've been to the toilet. Okay. But also, it's quite a small area, so just moving around, you know, just your underwear is moving bacteria.
Right.
And that's often why some women are prone to getting UTIs after sexual intercourse as well, because that's something else that helps move these bacteria around. So in women who get very simple UTIs with mild symptoms, who are otherwise well, have no underlying conditions and are young, then because of antimicrobial resistance, which is a real issue for people who get recurrent UTIs, we try and avoid using antibiotics when they're not necessary. And most of these simple UTIs will get better just from your immune system within 48 hours. Is
that right?
So we used to just prescribe antibiotics quite freely, whereas now it depends on the person, but the GP will have a conversation around the chances are this will get better if you're young, fit and healthy. Maybe we give a prescription of some antibiotics so that if it's getting worse or if it's not better after a couple of days, you take them. But in more complicated UTIs or in people who are more likely to have complications, then antibiotics are still used to treat them.
Should you always see a doctor, or is there anything over the counter you can get that, you know, just like you said, your immune system's going to tough it out over 48 hours?
I think the advice is that most people should contact a doctor. But if it's just a simple UTI and you don't get them currently, and you've had them before and they do go away within a couple of days, then you don't necessarily need to. If you feel quite confident, you can manage this. You can get the sachets, sodium citrate sachets, over the counter. They don't get rid of UTIs, but they can alleviate some of the symptoms when you're passing urine. So that's something else that you can do. But we're seeing more and more now people getting recurrent UTIs, where they're coming back more and more. And
Why is that, do you think?
The definition is if you have more than 2 UTIs in a 6-month period or more than 3 in a year.
Yeah.
One of the reasons is undoubtedly antimicrobial resistance. But also we know that these bacteria, when they get into the bladder, in a normal and uncomplicated UTI, they're just floating around in there. But what they can do is attach to the surface of the bladder wall. Right. And if they do that, they start to build these colonies, and they're sort of protected by a layer of slime that protects them from antibiotics that you take and from your immune system.
So they just stay there?
They sort of stay there and they flare up and settle down and flare up and settle down. And sometimes it might be when you're exposed to another bacteria that what we call the virulence, the strength of the bacteria, overcome the immune response, and then you get these types of symptoms. Wow. So there are various... So, you know, we're trying to avoid antibiotics as much as possible. one treatment for people who have recurrent UTIs is to take what we call a prophylactic antibiotic, so a dose every single day for up to a period of 6 months, sometimes up to 12 months. But there are some newer products that are available as well now. So there's something called D-mannose, because people talk about cranberry juice. Does having a glass of cranberry juice every day prevent a UTI? It's not very conclusive. Probably if you drink 8 glasses of cranberry juice, but I wouldn't recommend that because of the sugar. And there are other supplements. But actually, D-mannose, which is the active ingredient in the cranberry juice, you can now buy as a food supplement. So that can be effective in some people. You can try it. And then there's something called Hiprex, which is just about to go into the new NICE guidelines, which is like an antiseptic antibiotic that can be prescribed. But it is a problem, and I think, you know, knowing about antimicrobial resistance being a big issue, I think the underlying thing is if you have symptoms of a UTI, try and get a urine sample, speak to your GP and get it treated.
And how much danger is sepsis in all of this? Because can it develop into sepsis?
It can. So a complicated UTI untreated, most commonly in older patients or people who have other issues, diabetes, it can develop into sepsis and be very, very serious. So that's why anyone with underlying conditions who gets a UTI should also always speak to a doctor.
Just quickly, is it more susceptible in menopausal women?
Yes, so in menopausal women, because of the lack of oestrogen, which maintains the health of those tissues, it affects our natural microbiome. But the best treatment for menopausal women who get UTIs is topical oestrogen, so gels, creams and pessaries that are inserted into the vagina that helps replace that oestrogen, support the tissues, and is a really effective treatment and safe because it's not absorbed systemically and can even be bought over the counter.
Oh, thank you, Dr. Zoe.
Lots of information there. Lots on UTIs.
So good, thanks.
Thank you.